All right, so we've discussed the patient assessment process. Now I'm just going to demonstrate it in a medical patient, how simply we flow through these compartmentalized segments of this patient assessment process. So let's say I'm dispatched. This is going to be my 50-year-old male who's complaining of a little bit of chest pain and shortness of breath. So as I'm dispatched, I want to evaluate, is my scene safe? I'm going to have my BSI, so my gloves, my surgical mask, and whatever else I need. Number of patients, I'm going to have one patient that I'm dispatched for. Is it a mechanism of injury or nature of illness? Well, there's no obvious signs of trauma, so I'm going to assume that it's a nature of illness call. Additional resources, because it's a chest pain, shortness of breath call, I'm going to consider the fact that I might need an ALS resource, and then if I need any manpower or anything like that, once I show up, I'll ask for that. And C-spine precautions, it's a nature of illness call. There's no signs of trauma, so I'm not going to take C-spine precautions at this time. So now I'm out of my scene size up. I go into my primary. So I say, as I approach my patient, I'm going to form my general impression. So I have an adult male sitting upright in a chair. He doesn't appear to be in any great distress at the moment, and I know I've been dispatched for chest pain and shortness of breath. So I move on to my level of consciousness. My level of consciousness, I approach, I establish a rapport with my patient, I introduce myself, I say, hello sir, I'm with the fire department. I understand that you're having some chest pain today. Can you tell me a little bit about what's going on? And when he answers, and let's say he tells me, yeah, I've been having this chest pain and shortness of breath. I was out back mowing my lawn when I started having this chest pain, so I came in and called 911. Okay, great. Well, this automatically answers some questions for me. I established a bit of a rapport with him. I introduced myself. He spoke back to me. He answered me appropriately. So I know that his level of consciousness is alert. I know his airway's open because he spoke to me. Now I'm going to take a very brief moment to assess his breathing. I want to know rate, rhythm, and quality. So as he's sitting here, I watch his chest wall movement, and I notice that he's not breathing erratically. His rate seems to be within normal limits, and as I approach, I don't hear any audible lung sounds without my stethoscope. So I say his rate is within normal limits, his rhythm is regular, and quality is good. I don't hear any adventitious lung sounds without a stethoscope. Now I move on to circulation. Sir, do you mind if I just borrow your wrist for a second? So I check for a pulse. Remember, if this were the real world scenario, I would either remove the watch or travel to the side where he doesn't have the watch on. So I evaluate his pulse. Once I feel his pulse, all right, I get it established there. Okay, I'm checking rate, rhythm, and quality. His rate appears to be within normal limits. The rhythm is nice and regular, and I have a good, strong distal radial pulse here. So there's my circulation, and while I'm here, I note his skin. I'm going to check color, condition, and temperature. So color, he's got pink skin, he is warm, and currently he is non-diaphoretic. So at the moment, I'm going to pause and determine my patient's priority oxygenation requirements and transport. Priority, currently, I'm going to say I have a priority 2 chest pain patient. I know he's complaining of chest pain and a little bit of shortness of breath. Since I've been dispatched and he says to me he has a little bit of shortness of breath, I'm going to give him some O2. I'll worry about the vital signs later. So I'm going to give him a nasal cannula, 4 liters per minute. We'll start that. And transport, I'm probably going to transport to a cardiac intervention center once I'm finished with my assessment and my initial treatment. So I move on to my secondary assessment. I say, partner, do me a favor, get a full set of vital signs to include blood pressure, heart rate, pulse ox. We'll get a respiratory rate. Blood sugar is probably not indicated for this patient. We'll get lung sounds, and you can check pupils as well. So now I've got a full set of vitals coming, so I'm going to move into my secondary assessment. I say, okay, signs and symptoms. Sir, I realize that I've been dispatched here for chest pain and shortness of breath. Can you tell me exactly what's going on today? And he repeats the same story. He says, yeah, I was mowing my lawn out back. I have a push mower, and as I was pushing, I started to get short of breath, and I noticed that my chest felt really heavy and I had some pain there. I said, okay, well, there's my signs and symptoms. Sir, do you have any allergies? No, I don't have any allergies. Do you take any medications? And he says, yeah, sure, I have this whole list of medications. I have high cholesterol medications, I have this nitroglycerin medication, I've got high blood pressure medications. And I say, okay, so I've noted his medications, and then I'm going to ask another qualifier to that, have you taken any of those medications today? And let's say he says, well, I take my blood pressure medication in the morning, I have not taken the nitroglycerin yet. And I say, okay, great. How about any past pertinent medical history? And he says, sure, I have. I've been diagnosed with angina, I had a stent placed 2 years ago, I've got high cholesterol and high blood pressure. And I say, okay, so there's my past pertinent medical history. Last oral intake, when did you last have anything to eat or drink? And let's say he says, I had lunch about an hour ago. And I say, okay, great, what did you have for lunch? And he says, I had a turkey sandwich, some chips, and a Coca-Cola. And I say, okay, is that a normal meal for you? And he says, yes, it is. I say, okay, last oral intake. So E for events. Now, you said that you were push mowing your lawn prior to getting this chest pain. Anything else significant about that event? He says, nope, I was just push mowing my lawn when I started to get this dull pressure pain in my chest and having some shortness of breath. I say, okay, so the onset, I know that you said you were mowing your lawn when this came on. Was it very sudden? Was it gradual? How did it kind of come on to you? And he says, nope, it came on within the course of about 60 seconds of mowing my lawn, and it's been there ever since. I said, okay, sir, provocation, has anything that you've identified since it started make it better or worse? And he says, well, I came inside, I sat down in this chair, it's gotten a little bit better, but it's still present. All right, radiation, are you having any discomfort anywhere else, or does this pain travel to any part of your body? And he says, you know, now that you mention it, yeah, I've got a little bit of pain in my left shoulder and in the left side of my neck as well. And I say, okay, severity on a scale of 1 to 10. 10 being your worst chest pain ever, 1 being nothing at all. Where are you on the scale? And he says, well, my pain is currently at 8 out of 10. I say, okay, time. How long has this been going on? When did this start? And he says, about 15 minutes ago, right before me calling 911. And then I say, okay, have you done anything prior to me arriving? Have you done anything to try to help yourself before I got here? And let's say for this case, he says, well, the dispatcher told me to take 324 milligrams of aspirin, which I've done, and that's it, other than just sitting here. Okay. So now I need to do a focused physical exam. Sir, I know you're complaining of chest pain and some shortness of breath. I just want to take a look at your chest to give you a thorough assessment. I would expose the chest. Hands on, I'm checking for DCAP BTLS across all the areas of the chest. And I say, okay, sir, as I press, does this cause you any greater pain, or does your pain stay the same? And he says, nope, my pain still stays the same whether you press or not. And I've checked for my DCAP BTLS. And I do one more little qualifier here with my chest pain. I say, sir, do me a favor. If you take a big breath in, when you take that big breath in, does that change your chest pain at all, or does it consistently stay the same? And he says, nope, it consistently stays the same no matter how I breathe. So now I've done my physical exam. I've done all of my secondary assessment. My partner has gotten my vitals. I get my vital signs to qualify whether or not I can administer medications. If I'm going to administer medications, I do my RPM triple D, and then after I've assessed and treated my patient, I go on to my continuing reassessment throughout the duration of the call.